Dr. Rupert from VIVA Skin Clinics. Thanks for coming back to our YouTube channel, and today I'm going to be talking about busting those myths about dermal filler. So all those questions that are out there, we've taken the most common things and we've answered them for you today. A lot of people expect lots of pain with injections, but it's all about a safe technique and also using fewer injections with local anaesthetic cream provided. So local anaesthetic numbs the skin, making the injections a lot more comfortable. Dermal fillers can be used across the board, so for males and females alike, but it's all about what you want to achieve with the procedure. So I get a lot of male clients who like to have a little bit of a stronger jawline, areas underneath the eye and tired eyes to improve dark circles and tear trough area. BOTOX can be used in combination with dermal fillers to improve aesthetic results. So for example, common areas of treatment for BOTOX is the forehead, frown lines and smile lines around the eyes, so it relaxes muscles. Filler can be used for volumization and improving areas in the lower face, so both can be used in conjunction for your end result. However, I always do advise to separate your treatments into sessions. So sometimes it's good to get your BOTOX done and then wait for everything to kick in after 2 weeks or so, and then do your fillers. So make sure you do divide things up logically as well. The good news is the new dermal filler products contain something called hyaluronic acid. This can be completely dissolved using an enzyme called hyalase. So if there's some reason why you're not happy with the results or there's a problem, injections of hyalase can be carried out to dissolve the product. Filler results, in terms of how long they last, do tend to vary between product and area. So for example, lips, which need to have a little bit of a softer product, might last a bit of a shorter time compared to cheeks and chins. So there we inject a little bit of a thicker substance, a thicker product. That means that it may last a little bit longer. So once again, it's all dependent on the product and how it's injected. The manufacturers state that the product is licensed, so it can last for up to sort of 24 months. However, the majority of my clients, I do see them for some tweaks about once a year. A lot of people get worried that their results are going to look unnatural or you're changing certain features of the face. However, a safe approach to dermal fillers, so for example my 3D face refresh, means that you don't have the risk of that happening. So we're using smaller quantities of product to enhance and refine features, so you don't end up with unnatural looking results. The new fillers that are around at the moment are a lot more trialed and tested, so they're a lot safer to use, especially when injecting. So they contain a substance called hyaluronic acid, and hyaluronic acid sits under the skin naturally, so you have that anyway. So what we're doing is putting something that your body already has underneath the skin. So side effects wise, for example, you can develop things straight after the procedure, a little bit of bruising or redness where the injections have been carried out. In the longer term, sometimes the product needs to be balanced out a little bit, so always make sure you have a follow-up appointment after 2 weeks. So we always do our best to reduce your risk of any bruising after the procedure. So using arnica and also fewer injections mean that you run the risk of less bruising. Always make sure that you have a top-up planned. So a top-up being a check-up appointment after 2 weeks, after the product's all settled in, so you and your clinician can check everything through. Choosing an advanced practitioner alongside the products used will reduce your risk of developing any lumps or bumps. Make sure before you go to the clinic, just make sure you do your research, check how much experience your practitioner's got. So once again, make sure that you go to a suitably experienced clinician and make sure that the product being used is appropriate. So this will reduce your risk of bruising as well. For example, in my clinic I use something called a cannula, which means I don't have to do as many injections, and that will reduce your risk of bruising. Sometimes the filler takes a little bit of time to settle in, so 48 hours or so, for it to harden up a little bit under the skin. However, make sure you don't have anything major planned in the first sort of 7 to 10 days after injections, just in case there is that risk of bruising.
So like
A lot of people worry about their skin being affected when the filler dissolves and it's never going to go back to how it was or get worse. This is all a myth, that's all I can say. So what happens is that your skin and the volume will go back to exactly how it was before you had the injections done. The product actually dissolves into water, so there will be no worsening of your skin after the injections. I think this is one of the most common myths that we must talk about. So people get concerned about the fact that skin is not going to be quite how it was. So what happens is the product dissolves and breaks down into water over time, and your skin's going to go back to exactly how it was before the injections. Thanks so much for watching the video, guys. I hope that's addressed some of the common questions that are out there, but if you do have any more, just pop them in the comments bar below and we'll get back to you. Thanks again for watching, and we'll see you next time.